Hi everybody, my name is Stephanie Daniels. I'm a physical therapist with Chiafretti and Associates, and I specialize in pelvic floor physical therapy where we treat various conditions that relate back to the pelvic floor. One of the common conditions we see in relationship to bowel function is constipation. That can occur in constipation where the pelvic floor muscles are actually not working in a coordinated fashion, and they can almost become like a mechanical block to letting stool out. There's actually some exercises that you can perform to work on improving your coordination so that you can have an easier time with having a bowel movement without straining. So a lot of us tend to hold our breath when we're pushing to pass stool out. And that actually can become counterproductive when you're trying to efficiently push stool out of your body. So the correct way to actually have a bowel movement is to exhale as you're pushing. So when you exhale, typically what happens is the abdominals pull inward, and that activates the transverse abdominis muscle. That muscle has neurological connections with your pelvic floor muscles, so that when you activate that muscle, the pelvic floor muscles will co-contract. So while we do want to exhale as we're having a bowel movement, we don't want to draw those muscles inward as we're trying to exhale and push, because we might actually contract our pelvic floor. So the proper way to push in a 3-step process is to inhale into the belly so that the belly comes outward. That's the belly out portion, that's step 1. Step 2 is to exhale but keep the belly hard so that it does not draw inward. So you have to kind of think about keeping air in your belly, tensing the tummy as you blow air out, but not pulling inward, and that part can be a little bit tricky. And then the third portion is as you're actively pushing that you relax your pelvic floor muscles down, and that's known by a lot of pelvic health therapists as a pelvic drop. So 3-step process, we'll do it one time and then we'll try a few more. You're inhaling, taking the belly out, and then you are exhaling, keeping the belly hard and pushing down at the same time as your pelvic floor stays relaxed. Again, that's inhale in, belly out, exhale, harden the belly without pulling in. At the same time, feel your pelvic floor or your rectum going downward and relax. Again, inhale, belly out, exhale, harden the belly, continue breathing out, think about your rectum and push down with it relaxed. Now, the purpose of that exercise is to help with the actual coordination and mechanics of having a bowel movement. If you have any trouble with constipation or you think that your pelvic floor muscles might be uncoordinated, pelvic health physical therapists can assess what you're doing with your muscles, and we can provide some feedback and recommendations on how you can improve your muscle function as it relates back to symptoms of constipation. And that's one piece of the puzzle in managing constipation. If you have any questions or concerns or think that you need some help with that, feel free to give our office a call and we'd be happy to work with you.